It's World Mental Health Day. Mental health care is central to solving some of our big problems and smaller ones too, like helping navigate crises, division, and relationships with greater ease. Here to talk with us this morning about what's happening in mental health right now is Dr. Sandra Barris, Director of Clinical Training for Counseling and Health Psychology at Bastyr University. Good morning, Dr. Barris. Thanks for being with us.
Thank you for having me.
We did see a big spike in mental health care needs related to the pandemic. Where are we now this far into the pandemic?
Well, the good news is that for many communities, there is less stigma associated with accessing mental health care, and that's partly due to the pandemic. But there's still more to do. There are still pockets of communities that experience stigma around mental health needs, especially for those who live in rural areas or people who have come to America from other countries where they might have experienced things like war or violence. Also, communities of color are underrepresented in counseling. There are efforts underway at Bastyr and across the counseling profession to attract more mental health professionals from all backgrounds and a variety of communities. But one thing that we're doing at Bastyr is offering $25 telehealth counseling sessions to make counseling more accessible.
And Dr. Barris, if we are suffering or we know someone who is, what are some of the telltale signs that it's a mental health problem and not something else?
That's a good question. Mental health looks different for everyone, and there are some things that we can all be mindful of. First of all, though, I want to say that if you have someone that you love who is having a mental health crisis, use the crisis line. It puts you in touch with a mental health professional right away. But don't wait for a crisis to reach out to your loved ones. Notice things like changes in daily routines, things like changes in their eating habits or sleeping, or even if they're not accessing the beautiful natural environment that we live in the way that they usually do. When these things start changing, that could be a sign that someone that you love is struggling with a mental health issue. One thing that you can do is to start by reaching out to them and asking them if they are okay. Ask a question, being non-judgmental, and approach them with curiosity and compassion. You can follow up with other questions like, what's happened in your life, or how are you managing? And remember to take time to really actively listen and check in regularly.
Dr. Barris, what do you see for the future of mental health care, and what's changing in the field that we should know about now?
Mental health is really becoming more recognized as whole person health. So it's something that all of us need to take care of, just like we take care of our physical health. One thing that's really exciting after the pandemic is that telehealth has become much more common, even in the mainstream, and it seems to provide greater access to all kinds of people to counseling services. This makes counseling easier to try, and especially reaches a lot more of the younger generation who are more tech savvy. I'd also like to say, if anyone has ever wanted to become a counselor, this is a really good time to join the profession. There's a lot of job security, and it offers flexible work options. So consider training as a counselor as well.
Dr. Sandra Barris with Bastyr University, thanks so much for joining us.